Well, there is a mental health emergency in rural America. According to the CDC, suicide rates among people living in rural areas are 64 to 68% higher compared to people living in large urban areas. And of those people, only 1/3 say they're getting help or treatment. Well, joining me now is Karina Rasmussen from the Huntsman Mental Health Institute. Karina, thanks for joining us today.
Thank you for having me.
Our pleasure. Well, why does it seem like these people in rural areas kind of keep this issue to themselves?
Well, in particular, farmers and people in rural communities are very self-sufficient and they pride themselves on being that way. And so I think it's very difficult for them to talk about their mental health and mental well-being.
Why is it important to take care of your mental health the same way you would take care of your physical health? Like you go to the doctor if you get hurt or something along those lines, but why don't people do that for their mental health?
Well, we know that our mental health affects our physical health. And so we need to feel more comfortable being able to talk about our mental health in the same way that we talk about our physical health. We need to make it okay to say that we're feeling anxious or sad and ask for help from our own community, and then also ask for help from professionals.
Karina, what are the unique challenges and barriers that people in those rural communities face when it comes to mental health?
Well, access to mental health care is always an issue just because of their geographical location. But I also feel like pride and being hardworking makes it difficult for people to reach out and let their neighbors or their community members know, hey, I could use someone to talk to. Let's go grab a coffee. Or ask your friends, how are you really doing? So I think that they're also more isolated and have difficulty finding resources and finding help as well.
What are some tips to make mental health more of a priority in your life?
First of all, I think we need to start talking about it. That's the best thing we can do. Make it normal, stop the stigma. Secondly, there's lots of resources out there. LoveYourMindToday.org is a wonderful website with many resources, as well as 988, the National Crisis and Suicide Hotline.
How can people in these rural communities support one another in their mental well-being?
Reach out. Reach out to one another in the same way they reach out when you need help harvesting with your land, with your home. Rural communities have a strength in that they're always there for each other. So let's be there for our mental health as well. And don't be afraid to ask the hard questions and ask how your friends and neighbors are really doing.
Where can these folks look online to try to get some first stages for help?
Start with LoveYourMindToday.org. It's a great resource. And then if there's more of a crisis, the 988 Crisis and Suicide Hotline is a wonderful resource as well.
All right, Karina Rasmussen, thanks very much for joining us on the Midday today.
Thank you.